Dr. Ofer Levy joins us. Steve, thank you. He is a voting member of the FDA advisory panel. He's also a director of the Precision Vaccines Program at Boston Children's Hospital. Dr. Levy, what do you think about mandating children's vaccines? Is it the same as mandating it for adults? Should we think about it that way?
Well, thank you for that, Sarah. This is a critical question now, and it's, of course, a critical public health question, but it also touches on the social dimensions, as your piece alludes to. How do we want to organize ourselves as a country? How do we balance individual autonomy, which is an American principle, against the needs of the American people as a whole to stop this pandemic? Severe disease is low in children, but it's not negligible. According to the CDC, about 500 American children have died of COVID to date. And that's not to mention those that have been hospitalized or gotten very ill. And children can spread the infection to older individuals, whether it's their parents, grandparents, teachers, et cetera. And those individuals are at even greater risk of severe disease. So, let's see. I don't want to prejudge the data. We're going to have an FDA meeting on Tuesday. But if the data show safety and efficacy, then a good case could be made for a mandate.
Okay, so you're gonna judge the data. You're going to make this decision with your colleagues. Are you going to worry more about longer-term consequences, which we just don't have the data on, for children as opposed to adults?
Well, there are not too many examples in the global literature of a vaccine given to a child and then months and months later, suddenly some side effects severely showing up. There are just not a lot of examples of that. We have the first days after a vaccine where, of course, you could get local pain, redness. You could have a fever, feel lousy for a day or two. Many of your viewers are familiar with that from their other vaccines or their coronavirus vaccine. Then they get better and they're back on track. There are rare cases that emerge weeks later with certain side effects that are unusual. But in terms of something that just suddenly appears months and months later, there's just not a lot of evidence for anything like that, setting aside coronavirus vaccines, any vaccines. So we're going to take a careful look at the safety data. There will be a certain time frame of follow-up. Plus, there's all this surveillance that even if something is approved or authorized, there's safety surveillance that's ongoing. And we've seen, your viewers have seen, with a J&J or AstraZeneca, an entire vaccine program stopped for very rare adverse events that are then sorted out and modification is made to the label to try to avoid that. So I think the system is set up properly. I think there's a huge emphasis on safety. We give vaccines to those who are healthy, so they better be safe. And, let's let that public hearing happen on Tuesday. Let's look at the data together.
Doctor, before there were any vaccines available at all, there were lots of estimates as to how much of the population would need to be vaccinated to really essentially bring the pandemic to a standstill. I don't know what those numbers might have been, but when it comes to children, setting aside mandates, what proportion of children do you think would need to be vaccinated and thereby the whole population be vaccinated for us to essentially move to that next level where it's not really as much of a critical threat?
Thank you for that. That's a key question, and it relates to herd immunity. Herd immunity is when we get to a level of immunization that the virus is starting to run out of people to infect, and then we see a big drop in the pandemic, and that's what we're all working towards. Dr. Fauci put it very well. We only know when we reach herd immunity when we're there, and then we go below it, and then it comes back again. We know that for measles vaccine. You need 90% of a population immunized. If you drop below 90%, you have measles outbreaks. We don't know the exact number yet for coronavirus. We suspect that it's well over 80%. Maybe we need to be in the 80 and 90% range, but that's a speculation now. We need more data. The Israeli team from the Ministry of Health of Israel presented some data that started to show, with their impressive vaccination campaign and boosting, et cetera, perhaps some evidence of herd immunity, but we don't have all the numbers yet.